Hello students, and welcome to this high-yield revision topics for the NEET PG. बच्चों, we have started with this high-yield revision topics specially for you. आज का टॉपिक है femoral triangle. So students, let us understand this femoral triangle. ये कैसे बनता है femoral triangle? The boundaries of femoral triangle, the contents of femoral triangle. ठीक है बच्चों? So let us begin with this femoral triangle. Have a look at this. Now, these are the transverse processes of the lumbar. These are the bodies of the lumbar vertebrae. देखो अपन femoral triangle बना रहे हैं बच्चों, तो ये है bodies of lumbar vertebrae. These are the transverse processes of the lumbar vertebrae. ठीक है? So ये L5 हो गया, L5. So what is this now बच्चों? This is S1 है ना, S1. आप बोल सकते हो what is the body of S1 known as? Students, what is the body of S1 known as? The sacral promontory. Sacral promontory. ये मैंने sacrum draw किया, ये मैंने pelvic sacral foramen draw किए. You know what emerges? क्या आता है? What emerges from this pelvic sacral foramen, students? Any guesses? Yes. Any guesses what emerges out through this pelvic sacral foramen? Yes, the ventral ramus of the sacral spinal nerves. The ventral ramus of the sacral spinal nerves, they emerge from this pelvic sacral foramen. अब ये किससे ज्वाइन करेंगे? ये ज्वाइन करेंगे L4 L5 को, एंड इससे क्या बनेगा? अपना sacral plexus है ना, ऐसे sacral plexus बनता है. सो ये है बॉडी ऑफ S1, इसे हम बोलते हैं sacral promontory. That's the sacrum. बच्चों इसे क्या बोलते हैं? What is this known as? On either sides, this is the ala of the sacrum. Ala of the sacrum. As we come in front, what is this now? ये क्या होगा? Anterior superior iliac spine. और आगे आइए, what is this going to be? ये होगा pubic symphysis. ये है pubic tubercle है ना, ये है pubic tubercle. इसे क्या बोलते हैं? What is this area known as? This is what we call as the yes. What is this? Pubic crest. Yes, this is the pubic crest. ये है pubic symphysis. ये है pubic crest. ये है pubic tubercle. एंड इसे क्या बोलोगे आप? दिस इज द सुपीरियर रेमस ऑफ द प्यूबिस. बच्चों इसे हम बोलते हैं पेक्टिन प्यूबिस. पेक्टिन प्यूबिस, राइट? सो दैट्स द प्यूबिक सिम्फाइसिस, दैट्स द प्यूबिक क्रेस्ट, प्यूबिक ट्यूबरकल, एंड दैट्स द पेक्टिन प्यूबिस. ये होगा इंफीरियर रेमस ऑफ प्यूबिस. अब ये ज्वाइन करेगा रेमस ऑफ द इस्चियम को. नाउ बिफोर दैट, व्हाट इज दिस? ऑब्चुरेटर फोरामेन. ये होगा फीमर, या फीमर present within the acetabulum. ये है acetabulum. That's the inferior ramus of pubis with the ramus of ischium. क्या बोलोगे इसको? This is the conjoint ischiopubic ramus. Conjoint ischiopubic ramus. ये आ गया ischial tuberosity पीछे की तरफ. That's the ischial tuberosity. ठीक है बच्चों? अब what is this? Any guesses? ये मैंने क्या ड्रॉ किया? What is this going to be? This is the inguinal ligament. Inguinal ligament है ना? So ये inguinal ligament आगे की तरफ होता है, sacrum पीछे की तरफ होता है. You can get oriented. Sacrum पीछे है, inguinal ligament आगे की तरफ है. Now what is attached to this inguinal ligament? बच्चों, what is attached to this inguinal ligament? The muscles of the anterior abdominal wall. बराबर? The muscles of the anterior abdominal wall are attached to the inguinal ligament. अब ये देखिए, ये इंग्वाइनल लिगामेंट के नीचे ये स्पेस देख रहे हो आप? यू कैन सी दिस स्पेस बिलो द इंग्वाइनल लिगामेंट. दिस इज व्हाट वी कॉल एज द पेल्वी फीमोरल स्पेस. यस, ये है पेल्वी फीमोरल स्पेस. एंड बच्चों ये पेल्वी फीमोरल स्पेस जो होता है, इट इज सिमिलर टू व्हाट इज दिस फॉर द एक्सिला? एपेक्स ऑफ द एक्सिला. एपेक्स ऑफ द एक्सिला. कोरिलेट करिए, कोरिलेट. सो पेल्वी फीमोरल स्पेस इज सिमिलर टू एपेक्स ऑफ द एक्सिला. अब अगर किसी भी स्ट्रक्चर को फीमोरल रीजन में आना है, एनी स्ट्रक्चर, इफ इट हैज टू कम इन द फीमोरल रीजन फ्रॉम द लंबार रीजन और फ्रॉम द पेल्विस, ठीक है, लंबार रीजन या पेल्विस से, इफ एनी स्ट्रक्चर हैज टू कम डाउन इनटू द फीमोरल रीजन, ये स्पेस से आएगा, एंड दिस स्पेस इज नोन एज द पेल्वी फीमोरल स्पेस. आई होप यू आर गेटिंग दिस बच्चों. नाउ यू टेल मी व्हाट आर द स्ट्रक्चर्स व्हिच गेट आउट थ्रू दिस स्पेस. देखिए, these are the transverse processes, and यहाँ से there's a muscle which begins from the transverse processes of the lumbar vertebrae. There's a muscle which begins here. Any guesses बच्चों? What is this muscle? Any guesses? A muscle which begins from the transverse processes of the lumbar vertebrae. this muscle goes below the inguinal ligament and this muscle comes and gets inserted on the femur. Yes, when this muscle contracts, it does flexion of the vertebral column. Guess करिए, what is this muscle? What is this muscle? जो lumbar transverse process से begin होता है, gets inserted into the lesser trochanter of femur. Yes, that's the psoas major. Very good, that's the psoas major. And बच्चों on this psoas major एक nerve होती है. There's a nerve which lies on the psoas major. Any guesses? A very important MCQ. Nerve lying on the psoas major is the genitofemoral nerve. Perfect. Very good. अब बच्चों ये बोल सकते हो व्हाट इज दिस फोसा नोन एज, ये फोसा का नाम क्या है? दैट्स द इलियक फोसा, है ना, ये इलियक फोसा होता है. एंड दिस इलियक फोसा गिव्स ओरिजिन टू अ मसल नेम द इलियकस, एंड दिस इलियकस वुड बी कमिंग डाउन लाइक दिस एंड दिस इलियकस वुड गेट इंसर्टेड ऑन द फीमर. सो ये कौन है? इलियकस. पीछे जाता है, ये फीमर पे पीछे की तरफ जाता है. आई जस्ट ड्रॉन दैट फॉर योर अंडरस्टैंडिंग. सो ये इलियकस हो गया, ये psoas मेजर हो गया. टुगेदर व्हाट डू यू कॉल दिस एज द इलियोपsoas. इसे हम इलियोपsoas बोलते हैं. फाइन. नाउ there's a muscle which begins from this superior ramus of pubis and gets inserted on the femur. इसका नाम क्या होगा बच्चों? Pectineus. Very good. Superior ramus of pubis से femur की तरफ आता है. This muscle is the pectineus muscle. And there's one more muscle which begins from the body of the pubis and gets inserted on the femur. इसका नाम क्या होगा? This is the adductor longus muscle. Adductor longus. ये है adductor longus. So 4 muscles बन गए students. 4 muscles: iliacus, psoas major, pectineus and adductor longus. Adductor longus. ये 4 muscles बन गए. And एक मसल होता है which begins from the anterior superior iliac spine. ये देखिए बच्चों, what is this muscle? Any guesses? ये मसल क्या होगा? A muscle which begins from the anterior superior iliac spine. That's the sartorius muscle. Sartorius. So बच्चों यहाँ पे एक triangle बन गया. Can you appreciate this? And this triangle is known as the femoral triangle. Femoral triangle. So now you tell me, what are the boundaries of femoral triangle? Boundaries of femoral triangle. Laterally, okay, let me just define this. Laterally would be, what is this muscle? ये क्या muscle होगा? Sartorius. Laterally is the sartorius. Medially is the adductor longus. ये ना, ये adductor longus. The base is formed by the inguinal ligament. Base किससे बनेगा? Inguinal ligament से. Clear students? Boundaries clear है? Medially adductor longus. Laterally is the sartorius. The base is formed by inguinal ligament. And floor किससे बनेगा? Floor would be formed by which muscles? Number 1 iliacus, number 2 psoas major, number 3 pectineus, and number 4 adductor longus. Number 4 is the adductor longus itself. 4 muscles floor बनाएंगे, मतलब iliacus, psoas major, pectineus and adductor longus. बच्चों understand this. Adductor longus floor में भी होता है. Adductor longus also forms the medial boundary. समझ में आ रहा है ये आपके? Adductor longus medial boundary भी बनाएगा, adductor longus floor में भी होगा. So this is the femoral triangle. I hope this is clear to all of you students. Have you appreciated this? कैसे बना ये femoral triangle? What is pelvic-femoral space? कैसे structures lumbar region या pelvis से femoral region में आते हैं through this pelvic-femoral space? Okay, right, very good. Appreciate this slide. Okay, I'll show you another slide, right? I'll show you another slide. एक minute. Have a look at this slide. Students, can you guess this? चलो, what is this muscle? Number 1. ये कौन है? ये है sartorius. Sartorius. What is this? Number 2. ये है अपना adductor longus. Adductor longus. What is this here? ये क्या होगा? Inguinal ligament. Inguinal ligament. ठीक है? And what is the floor formed by? Number 1, that's the iliacus. Number 2, that's the psoas major. Number 3, that's the pectineus. And number 4, that's the adductor longus itself. That's the adductor longus itself. ये clear है? Femoral triangle students, clear to all of you? Yes, very good. So that's the femoral triangle. Now understand this. I'll tell you something else now. Yeah, have a look at this slide once again. Yeah, chalo. Now you tell me, this is the iliacus muscle. ठीक है ना, ये iliacus muscle है. एंड ये iliacus muscle पे बच्चों एक fascia होता है. Fascia. Any guesses what is this fascia known as? This covers the iliacus muscle. The same fascia comes down. What is this fascia known as? The fascia iliaca. ये होगा fascia iliaca. So fascia iliaca क्या कवर करेगा? iliacus muscle को कवर करेगा, and the same fascia iliaca inguinal ligament के नीचे से it will come in the femoral region. So who covers the floor of the femoral triangle, students? Fascia iliaca. Fascia iliaca. अब बोलो बच्चों, what is attached to this? One moment. Okay, I've cleared this. Now, what is attached to this inguinal ligament in front? Inguinal ligament को आगे की तरफ क्या होता है? What are the muscles attached to the inguinal ligament? There are three muscles: external oblique, internal oblique, and transverse abdominis. ठीक है ना? तीन muscles होंगे. मैं एक slide दिखाता हूँ आपको बच्चों. Just have a look at this slide. What is attached to the inguinal ligament in front? Can you answer this MCQ? ये MCQ answer करिए. Floor of femoral triangle is formed by all the following except iliacus, yes. Pectineus, yes. Psoas major, yes. Adductor brevis, no. Adductor brevis does not lie in the floor of the femoral triangle, right? Very good. अब ये स्लाइड देखिए बच्चों. What is this view? ये कहां से देख रहे हो आप? कहां से देख रहे हो? दिस इज अ साइड व्यू. सजाइटल सेक्शन लिया हमने एंड साइड से आप देख रहे हो. सो दिस इज अ साइड व्यू. व्हाट इज दिस मसल? ये क्या मसल होगा? इलियाकस. ये इलियाकस मसल है. एंड व्हाट इज दिस फेशिया व्हिच कवर्स द इलियाकस? ये क्या फेशिया होगा? दैट्स द फेशिया इलियाका. एंड दिस फेशिया इलियाका कवर्स द इलियाकस एंड इट कम्स डाउन इनटू द femoral region. परफेक्ट. अब what is this? ये कौन है? That's the inguinal ligament. What is attached to the inguinal ligament? What is this muscle? External oblique. ये क्या होगा? Internal oblique. ये क्या है? Transverse abdominis, right? The muscles of anterior abdominal wall, they are attached to the inguinal ligament. External oblique, internal oblique, and transverse abdominis. अब बच्चों, transverse abdominis के पीछे एक fascia होता है. What is that fascia which is behind the transverse abdominis? ये बोल सकते हो. What is this fascia behind the transverse abdominis? That's the fascia transversalis. And this fascia transversalis comes down. ये ना inguinal ligament के नीचे से आएगा. It goes below the inguinal ligament and comes in the femoral region. देखो देखो देखो, ये femoral region में आ गया. मतलब दो fascias आते femoral region में. One comes from front. आगे से आएगा. What's that? Fascia transversalis. And एक पीछे से आएगा. That's fascia iliaca. Together, these two muscles are going to form what? The femoral sheath. ये बनता है femoral sheath. Understanding, students? So how is the femoral sheath formed? Anteriorly, this is the fascia transversalis. ये होगा fascia transversalis. And posteriorly, that's the fascia iliaca. Fascia transversalis and fascia iliaca. Clear? समझ में आ रही है? अब this femoral sheath has got three compartments. I'll just make this femoral sheath. मैं ये femoral sheath बना रहा हूं आपके लिए. देखिए, that's the femoral sheath. Okay, इसका anterior layer कैसे बनता है? Fascia transversalis से. And posterior wall कैसे बनेगा? Fascia iliaca. There are three compartments in the femoral sheath. This is the lateral compartment, that's the intermediate, and that's the medial compartment. ठीक है? Lateral, intermediate, medial. अब बच्चों बोलो, who lies in the lateral compartment of the femoral sheath? That's the femoral artery plus the genital branch of genitofemoral nerve. The femoral branch of genitofemoral nerve. I'm so sorry. The genital branch of genitofemoral nerve goes in spermatic cord. Yes, spermatic cord. So lateral compartment of femoral sheath में क्या होगा? इसमें होती है femoral artery plus the femoral branch of genitofemoral nerve. Perfect है बच्चों? This is very important MCQ. What is in the intermediate compartment of the femoral sheath? Intermediate compartment में होती है femoral vein. Femoral vein. And जो medial compartment होता है ना, ये empty होता है. The medial compartment is empty. What is this known as? The femoral canal. इसे हम बोलते हैं femoral canal. ठीक है, समझ में आ रही है? So lateral, intermediate and medial compartment. Once again, lateral compartment में क्या होता है? Femoral artery plus the femoral branch of genitofemoral nerve. Intermediate compartment में क्या होगा? Femoral vein. And medial compartment empty होता है, खाली होता है. What is that known as? Femoral canal. Femoral canal, right? The upper part of this femoral canal, one moment, the upper part of this femoral canal is known as the femoral ring. इसे हम बोलेंगे femoral ring. Look, this is the femoral ring. जो femoral canal का upper part है, that is known as the femoral ring. समझ में आ रहा है ये बच्चों? Are you clear? Have a look at this. So एक बहुत common MCQ आता है. One moment. Look at this, students. Look at this. ये क्या है? That's the femoral sheath. So what is this? Anterior wall formed by fascia transversalis. Posterior wall किससे बनेगा? Fascia iliaca से. तीन compartments है. This is the lateral compartment. That's the intermediate compartment, and that's the medial compartment. Clear है? So lateral compartment में कौन है? देखिए, the femoral artery. Yes, that's the femoral artery, and this is the femoral branch of genitofemoral nerve. Intermediate compartment में that's the femoral vein, and the medial compartment is empty. इसे क्या बोलोगे आप? Femoral canal. Femoral canal. The upper part of femoral canal is known as femoral ring. Femoral ring. ठीक है? I'll just draw this for you. देखिए बच्चों. So what is this now? This is the femoral sheath. ये है fascia transversalis. पीछे होगा fascia iliaca. ये ऐसे मैं बनाता हूँ इसके तीन compartments. देखिए. So that's lateral, that's intermediate, and that's medial compartment. Clear है बच्चों? Perfect. This is perfect. Okay, so just coming back to this slide that I've drawn. So what are the boundaries of femoral ring? ये है अपना femoral ring. इसके boundaries देखिए. I'll just put numbers. This is number 1, this is number 2, this is number 3, and that's number 4. So what is this? Number 1. 1 is the inguinal ligament. Inguinal ligament. What boundary is that? That's the lateral boundary. Lateral boundary. So that's the anterior boundary. Lateral नहीं होगा. That's the anterior boundary. Anterior boundary is formed by inguinal ligament. Inguinal ligament. ठीक है ना? बच्चों ये inguinal ligament ही होता है. अब ये inguinal ligament turn होगा. ऐसे turn. So what is that known as? Medial. Medial होगा. ये number 2 होगा. And what is this turn known as? It is known as the lacunar ligament. Lacunar ligament. Lacunar ligament is also known as Gimberneck's ligament. Gimberneck's ligament. ठीक है? So number 1 is the inguinal ligament anteriorly. अब ये inguinal ligament ऐसे turn होगा medially. What is that known as? Lacunar ligament. अब same lacunar ligament पीछे जाएगा posteriorly. Posteriorly it goes on the pecten pubis and इसका नाम होगा pectinate ligament. Pectinate ligament or Cooper's ligament. Cooper's ligament. So number 3 is the pectinate ligament or Cooper's ligament, and laterally is number 4. Laterally क्या होगा बच्चों? Laterally is the septum, separating it from femoral vein. Femoral vein है ना? So laterally is the septum separating it from the femoral vein. Clear है बच्चों? So this becomes the boundaries of the femoral ring. Anteriorly is the inguinal ligament, medially is the lacunar ligament, पीछे होगा pectinate ligament, and laterally is the septum separating it from femoral vein. Now this femoral ring is closed by a lymph node. यहाँ पे एक lymph node होगा. This femoral ring is closed by a lymph node, and this is what we call as the lymph node of Lockett, lymph node of Lockett or Rosenmuller. Okay, so the femoral ring is closed by a lymph node, and इसे हम बोलेंगे lymph node of Lockett. Hello, बुरुद्दीन, हेलो, समझ में आ रहा है? बुरुद्दीन, yes. So this is the lymph node of Lockett or Rosenmuller, and what is this lymph node drain? Students, ये बहुत important MCQ है. What is this lymph node of Lockett or Rosenmuller drain? It drains the glans penis and the glans clitoris. Glans penis and the glans clitoris. ये दूसरा बहुत इंपॉर्टेंट MCQ है बच्चों, याद रखिए. अगर MCQ आता है penis or the clitoris drains into, बोलो बच्चों, your answer. Your answer is going to be the superficial inguinal lymph nodes. ठीक है बच्चों, अगर MCQ आता है penis or clitoris drains into, your answer is going to be the superficial inguinal lymph nodes. अगर एमसीक्यू आता है द ग्लैंड्स पिनस एंड द ग्लैंड्स क्लाइटोरिस ड्रेन्स इनटू, then your answer is going to be the lymph node of Cloquet or Rosenmuller. Lymph node of Cloquet or Rosenmuller. Clear है बच्चों? Is this clear? This is a very important MCQ. हाँ, तो I've told you the femoral sheath का formation कैसे बनता है, anteriorly posterior layer कैसे बनता है, ये बहुत important है. इसके 3 compartments are very important. Contents of this femoral sheath are very important. बच्चों, femoral nerve होती है content of femoral sheath. What do you say? Is femoral nerve a content of femoral sheath? No, femoral nerve is not a content of femoral sheath. The femoral nerve lies outside the femoral sheath. ये femoral sheath के बाहर होती है, right? So I've told you the contents of the femoral sheath. The medial compartment is known as the femoral canal. Upper part of femoral canal is femoral ring. मैंने boundaries of femoral ring भी बोला है आपको, right? अब बोलो बच्चों, yes, FMT Guru, yes, thank you. Now you tell me this femoral ring is wider in whom? Males में होता है wider या females में होता है ये wider? Femoral ring, बच्चों, can you guess this? Femoral ring is wider in, yes, females. Yes, very good. Femoral ring is wider in females. Why? Because the pelvis is wider in females. ठीक है ना, एक तो pelvis wide होता है. Secondly, the femoral vessels are smaller in size. ठीक है ना, femoral vessels छोटे होते हैं. Femoral vessels are smaller, the pelvis is wider, therefore automatically the femoral ring becomes wider in females, right? So chances of femoral hernia are more common in whom? Females, right? No? समझ में आई है? Chances of femoral hernia are more common in whom? Females. Why? Because pelvis wide होता है, femoral vessels छोटे होते हैं. So automatically the femoral ring becomes wider in females. So बच्चों, chances of femoral hernia are more common in whom? Females. Right? You become a surgeon in future. आप सर्जन बन गए, आपके पास एक femoral hernia का केस आता है. femoral hernia का केस आ गया. Now you have to reduce the hernia. आपको hernia reduce करना है, तो आप क्या करोगे? You have to dilate this femoral ring, है ना? ये femoral ring को आपको dilate करना है. You have to cut one of the boundaries of femoral ring. बच्चों, कौन सी boundary आप cut करोगे? Which boundary of the femoral ring are you going to cut? We are going to cut this boundary of femoral ring. Number 2, that's a lacunar ligament. आप lacunar ligament को cut करोगे, you'll dilate the femoral ring, you'll push the hernia upwards and you'll put a mesh there, right? That's how you reduce a femoral hernia. समझ में आया बच्चों? देखो, अगर femoral hernia हो गया, so you have to dilate the femoral ring. ऐसे ऊपर नहीं जाएगा ना hernia, you have to dilate the femoral ring. वो femoral ring dilate करने के लिए you have to cut one of the boundary of the femoral ring. So कौन सा boundary of आप cut करोगे? You will cut the lacunar ligament. बच्चों, this boundary you're going to cut, the lacunar ligament. You dilate the femoral ring, you push the hernia upwards, you put a mesh. That's how you reduce the hernia. Fine बच्चों, fine, very good. But you are a very brilliant surgeon बच्चों. You know, occasionally, बहुत rarely, on this lacunar ligament, ये जो lacunar ligament है ना बच्चों, I'll just clear this up. On this lacunar ligament, sometimes there's an artery here. बहुत rarely यहाँ पे एक artery होती है. Any guesses बच्चों? What is this artery? Yes, any guesses? What is this artery? इसका नाम क्या होता है? This is the abnormal obturator artery. Abnormal obturator artery. Right, this abnormal obturator artery is a branch of inferior epigastric artery. So ये lacunar ligament पे occasionally क्या होगा? Abnormal obturator artery, and this abnormal obturator artery is a branch of inferior epigastric. का बच्चों, ये बहुत important MCQ है. Abnormal obturator artery is a branch of inferior epigastric artery, and if we cut this lacunar ligament बच्चों, and अगर यहाँ पे एक abnormal obturator artery होगा, it would lead to hemorrhage, right? You are a very brilliant surgeon, your anatomy is very good, your anatomy is perfect, so आपको पता है occasionally यहाँ पे abnormal obturator artery हो सकती है. You will be very careful. आप lacunar ligament cut करने से पहले वहाँ पे देखोगे whether there's an abnormal obturator artery, right? So these are the boundaries of femoral ring. I hope this is clear to all of you students. I'll show you some MCQs. Have a look at this MCQs. Chalo, answer this. MCQ. Students, femoral ring is bounded by all the following structures except femoral vein. क्या बोलते हो? Femoral vein. Yes, it is the lateral boundary. Correct. Inguinal ligament. Yes, it's the anterior boundary. Lacunar ligament. Correct. It's the medial boundary. So what does not form the boundary of femoral ring? That's the femoral artery. Femoral artery. Very good. Very good, bachcho. Very good. Chalo, answer this. Regarding femoral canal, which is correct? Which is correct? Femoral canal आपको पता है, right? Smaller in females. Students, this is wrong. Correct? It is wider in females. है ना? Femoral canal is wider in females. तो ये wrong है. Contents the femoral vein. Is this correct, students? Femoral canal का content femoral vein होता है? नहीं. It is an empty compartment. It's an empty compartment, right? There's a lymph node there. Inferior epigastric artery lies medially. क्या बोलते हो? Correct है? Is this correct, students? No. Inferior epigastric artery नहीं होती है. It's a branch of inferior epigastric artery. उसका नाम abnormal obturator artery. That's abnormal obturator artery, right? So the medialmost compartment of the femoral sheath. That's the correct answer. So femoral canal is the medialmost compartment of the femoral sheath. This is perfectly clear to all of you students. Okay. I hope this is clear to all of you. Any doubts? Just ask your doubts in the comment section. So abnormal obturator artery, I was telling you, it's a branch of inferior epigastric artery. Students, एक normal obturator artery होती है क्या? Is there a normal obturator artery by any chance? क्या बोल रहे हो? होती है कि नहीं? होती है. Yes. So abnormal artery, I mean एक normal obturator artery भी होती है, and this obturator artery is a branch of anterior division of internal iliac. Students, obturator artery जो एक अपनी normal obturator artery होती है, it is a branch of anterior division of internal iliac. Very good. You're very nice. So abnormal obturator artery, it's a branch of inferior epigastric, and ये जो inferior epigastric artery होती है ना बच्चों, it itself is a branch of external iliac. ये खुद external iliac की branch होती है, inferior epigastric artery. So I hope this is clear to all of you students. So today what have we discussed? A small topic अपन ने डिस्कस किया femoral triangle. So मैंने आपको boundaries of femoral triangle बोल दिया. Lateral medial, the base is formed by inguinal ligament. Floor of femoral triangle हमने डिस्कस किया. Lateral to medial, iliacus, psoas major, pectineus and adductor longus. Contents of femoral triangle would be femoral vessels enclosed in the femoral sheath. The femoral branch of genitofemoral nerve, right? The lateral cutaneous nerve thigh. And lymph nodes, the deep inguinal lymph nodes, right? So then I told you about the femoral triangle. What are the boundaries of femoral? I mean, then what are the boundaries of femoral sheath that we discussed? Anterior boundary, posterior boundary. उसके compartments discuss किए. Femoral ring हमने discuss किया. The boundaries of femoral ring हमने discuss किया. And this femoral ring is wider in whom? ये हमने discuss किया. Right, and occasionally the abnormal obturator artery would lie on the femoral ring, leading to hemorrhage. So students, I hope this topic is clear to all of you, and we'll have a series of lectures on this YouTube channel of MedEd. Students, subscribe to this channel. In case of doubts, you can put your doubts in the link in the comment section. I'll get back to you, students. I hope this lecture is clear to all of you. Subsequently, we'll be starting this lectures, okay? And every week I take one lecture on this YouTube channel. Be there and let it be an interactive session, students. I hope this is clear to all of you. Thank you. Any doubts? Any doubts you have, you let me know. Thank you to all of you students. Thank you. Bye-bye.